If you struggle with dental problems, you've been told you don't have enough bone for implants, or maybe you're miserable with your dentures, you are not alone. New Teeth Now has helped thousands of people get new smiles, and it can be done in one day. Welcome, I'm Janie Porter, and joining me today is board-certified New Teeth Now surgeon, Dr. Lawrence Musser from Florida Dental Implants. Thanks for being here.
Thank you, Janie.
I'm so excited to have this discussion today. I have so many questions.
You did your research.
A little bit of research, but I'm coming in, as maybe many of you are, with a lot of questions about this process.
Sure.
So I'm excited. Let's first talk about New Teeth Now. What makes you guys different?
Well, we have a state-of-the-art facility. That's one of the things that makes us different. And we have all the technology, but we have a human touch also. We know that we're treating people that have a lot of fears. They've put off dental treatment. Some people haven't been to the dentist for 20 years. And they know that they have dental problems, but are afraid. So when we see those people, we reassure them that we're going to be able to take care of their problems. And we can do it all in one day.
Let's start at the beginning, because
Okay.
If you're watching and you have a lot of trepidation about this process, perhaps your teeth are in bad shape, or maybe your parents' teeth are in bad shape, and you know that at some point you're going to have to deal with this with either them or maybe even yourself down the road. What is the first step?
Well, the first step is to come in for a consultation.
Okay. What does that entail?
Well, the first thing we do is a CAT scan, and we have two CAT scans in our office. And the CAT scan gives us very, very accurate measurements of your facial bones. We can examine that. We can tell exactly where we need to place the implants, and I can sit down with you or with my patient and talk about what needs to be done step by step. So that process takes an hour or more. I want people to really be informed about what we have to offer.
I want to get to one of our first questions. It's from Julie in Palm Harbor. And she says, my mom has dentures, my grandfather has dentures.
Wow.
I'm 42 and my teeth are becoming loose. So she has three questions. This first one is one of my questions. Do bad teeth run in the family?
And the answer is yes, they can.
Mm-hmm.
Genetics is a big part of all of us, and unfortunately, if mom and dad both have dentures, then you may be one of those people that's more predisposed to having dental disease. And it sounds like with the loose teeth that she has what we call periodontal disease. And that is...
And she's only 42.
Right, but that can happen. Happens even younger. And that's bacteria in the mouth that are eroding the bone around the tooth roots. So eventually, there's not enough bone to really support the tooth.
So bad teeth can be hereditary, which makes me feel better because my toddler has 3 cavities, and I thought, I brush your teeth all the time, but bad teeth run in the family, they run in the family, and you have to think ahead as to how to deal with that. Okay, so her second question is there anything I can do to save my teeth?
Well, if they're already moving, they're probably past the point of being saved. But that's why New Teeth Now was developed, because there's so many people that are in that same situation and they don't really know what to do. So New Teeth Now is the answer. We can get you back to where you want to be with a nice smile, functional teeth, and do it all in one day while you're asleep.
And even if you're 42 and a few of your teeth are loose, you're still a great candidate for New Teeth Now. It doesn't need to be all the way down the road, all your teeth are in bad shape.
No, you don't have to wait. As a matter of fact, we've treated people as young as 24 years old.
No kidding.
Now, most of those very young people have used too much sugar, too much sweet tea, too much Mountain Dew, and they have it with them all day long, and their teeth have gotten decayed. So dentists deal with tooth decay and they deal with periodontal disease. Those are the two big things that cause people to lose their teeth. And we have the answer for all those people.
Julie's final question is about what is the difference? Go through some of the, compare and contrast dentures and implants. For someone who's just learning about this.
Yeah, well, let's talk about chewing.
Okay.
If you have dentures, dentures move around. You can only chew with 10% of your natural tooth force, so you really aren't chewing
Wow.
anything.
Right.
You're not chewing up or masticating a piece of steak, you're swallowing it whole. What's that do to your stomach?
A lot
It
of
causes
work.
gastric reflux. Lots of people that wear dentures have gastric reflux and a lot of problems with that. You know, with dental implants, you're getting 100% of your chewing power. It's just like having your natural teeth back. So the implants, if you think about them replacing the roots of the teeth, they do actually go into the bone structure in the upper and lower jaw. And we put them in a position so that the new teeth now can be attached to the implants. So the implants are like an anchor or a foundation. So it's like building a building. You want to have a strong foundation. We put enough implants in to make a strong foundation so the teeth can be attached.
And when you see graphics like this, it's incredible. And I have to be honest with you, when I see that, I think, oh, does that hurt though? And I'm sure you have a lot of people who say that when they see these pictures. How does this not cause any pain afterwards?
Well, nothing moves in your mouth, and the implants are firmly attached to the bone. The teeth are firmly attached to the infrastructure of the implants, so there's nothing moving, and there are some stitches and things that we put in, but the new teeth actually cover those stitches, so you don't have anything moving around. And I think that's why people are very happy and comfortable just taking ibuprofen, Advil, Motrin are the two brand names, and some people use Tylenol.
We have another question. It's
Great.
from Alexander in Inverness.
Okay.
Alexander says, I don't understand how you can support all of my teeth with only 4 implants on the top and 4 implants on the bottom. Do you only give us 8 new teeth? They're wondering how you do this without an implant for every single teeth. Shouldn't we get 32 implants to support 32 teeth? Alexander wants to know.
Yeah, have we shown that video clip? I guess we can do that again.
Well, explain how this is possible, because we can see it, but I think it's hard to connect the dots sometimes.
Once we put in our 4 implants, and the new teeth are made as a bridge, they're one piece so that it acts as a connector.
The darker colored
Yes.
gum area, let's call it in quotes, what is that made of?
So that's made out of zirconium.
Okay. Oh, wow.
In the final teeth that we make. And initially the teeth are acrylic, and after all the healing process is over, 3 or 4 months, then we make a final set of teeth that's made out of zirconium. Zirconium is very hard, but it has the properties of porcelain. So it's translucent, it reflects light just like normal enamel. It's really the best substitute for natural teeth, and I think my patients will tell you that it's just like natural teeth or even better. They're very easy to clean, they don't decay, they don't break. Natural teeth, we have all kinds of problems with, right?
Exactly. We have a clip we want to show, and this is someone named
Okay.
Bruce. He had severe dental issues.
I used to smile constantly. Every picture that was ever taken of me, smile ear to ear. Now, not so much.
We've been married for 1.5 years now, together for 2.5 years. Sadly, he doesn't smile like he used to because he's so self-conscious.
I started losing more and more teeth, and that's when I went to see Dr. Richards at Florida Dental Implants. After I had the surgery done, and after they put my new teeth in, and they handed me a mirror, the thing I'll never forget was looking in that mirror and seeing a full set of teeth, perfect teeth in my mouth. I started to cry. My wife, she loves me, no doubt. The turnaround was the first time I kissed her, passionately. Talk about a boost. My ego is through the roof. It was amazing. New teeth now is the way to go. I wouldn't go with anybody else. I wouldn't.
That moment.
Quite a
when
change.
When he looks in the mirror.
Right.
Wow.
You know, if we can take care of your teeth and give you your smile back, You know, everybody's got a smile in here.
So
okay?
true. So true.
We just need to let it out. That's what New Teeth Now does. That's the best thing.
We're getting some questions, and so I'm going to ask one from Caleb. He wants to know how long is the surgery?
Okay.
And this is a great question. How long is the recovery period?
Yeah, that's both good questions. So the surgery length is from 3 to 4 hours, and that depends on whether we're removing teeth and how many implants we put in. Some people that have severe bone loss, say they've worn dentures for 40 years. We may have to use
Wow.
a special type of implant that actually goes into the cheekbone, and that type of more complex case might take 4.5 or 5 hours.
And something I want to reiterate here is when you talk about putting something up into the cheekbone, you are one of the few surgeons in the world
Yeah,
who is able to do this.
We have 3 board-certified surgeons at New Teeth Now, and all of us do zygoma implants, and we have for years. We can treat every patient that comes in, even people with severe atrophy, because of the zygoma implant.
He's being very modest. You're one of 3 surgeons out of 15 in the world who can perform this. That's incredible.
We saw a need, and we started performing the zygoma procedure, and we've really become experts.
So the recovery period, what time does the surgery tend to end in the day,
so,
and how does that work?
We're usually done around noon. And then our technicians retrofit the teeth that we've made ahead of time to the implants. Now that process takes about 3 hours. You'll be recovering in a big, comfortable recovery room chair, and you have your family with you, flat screen TV. So we're looking at about 3 o'clock or 3:30. We're ready to put the teeth in. And you know, most people are able to eat that day, something soft. So we want them to start out slow, have a soft diet, and gradually work into what they feel comfortable with.
And we have a question from Alexis in Brooksville. She
Okay.
says, my doctor said I have a great deal of infection in my mouth, so I had deep gum cleanings, but the
Okay.
infection returned. So what's going on with my mouth, and can you make it better?
So she has periodontal disease, one of the things the dentists treat, tooth decay, periodontal disease. And she had a very common dental procedure, deep cleaning, and that helps to eliminate some of the bacteria. But the bacterial growth starts over again. There's no way to remove all of the bacteria that are underneath the gum. So, you know, you can continue to do that, and if you have deep cleanings every 3 months, then that'll help to prolong the life of your teeth. But a lot of people find that difficult to sit through. And
you're not getting to the source of the issue, right?
yes, you're not
the
really
source of the
eliminating the bacteria that are the pathogenic bacteria that are in your mouth.
And is there any way to do that?
Eliminate the teeth, and that's
Okay.
what dental implants do.
Okay.
When we place our dental implants and remove the natural teeth, all the bad bacteria, the ones we call pathogens, are gone. So that automatically makes you healthier. Anybody that has infection in their mouth, it can affect your heart. It can increase the chances of stroke. Those bacteria, and if your gums are bleeding, that means that there's an open blood vessel where bacteria can enter your bloodstream and irritate the vessels inside your heart and in your brain. So that's
Wow.
not good. We know that.
Serious.
So that's where implants come in as an important treatment.
I want to get to another clip
Okay.
about New Teeth Now, and it just sort of describes the New Teeth Now process over at Florida Dental Implants.
Okay.
Let's take a look.
When you choose New Teeth Now, you are choosing a one-stop, world-renowned surgical center with a reputation for excellence. You're choosing doctors with over 100 years of combined surgical and restorative experience, and you're choosing a state-of-the-art on-site dental laboratory, all put in place to provide patients with a one-of-a-kind dental procedure with a global reputation for lifelong results. As part of your initial consultation, you'll receive a high-resolution 3D CT scan. You'll meet privately with an implant coordinator, the implant surgeon, and the restorative dentist who use these 3D images to evaluate your case. At Florida Dental Implants, we're sensitive to your struggle. We'll talk with you about your individual needs, provide alternatives, and customize a treatment plan specifically for you. We have 3 fully equipped state-of-the-art surgical suites featuring leading-edge technology and 18 patient procedure rooms for general oral surgery. Patients rest after their procedures in quiet comfort in our private and semi-private recovery areas. At Florida Dental Implants, our team includes experienced master certified dental technicians. Using the latest technology, they assist us in creating your new custom teeth right here on site in our state-of-the-art lab. Every step of the way, our team ensure the highest quality care because your smile is priceless.
And I think the key there is everything for your patient is under one roof. You've got the CT scan happening there, recovery, private recovery room. And we're talking about a really revolutionary type of dental implant.
Right.
You use titanium to
Well,
attach.
Titanium has been around for a long time. It's been tested. It's used in all the orthopedic procedures, the knees and hips, all the little bone plates and things that we use to repair bones. So we know that it's biocompatible. That means it's not going to be rejected by your body. And we know that it actually fuses to the bone. And to help that process, we use Nobel BioCare implants. They're manufactured here in the United States. And part of their manufacturing process is to roughen the surface. Now what that does is increases the surface area, and it allows the microscopic bone cells to actually grow into the surface of the implant.
That makes sense, a rougher surface,
Right,
so the body just
exactly.
grows right around it and it really
And
secures.
they're a great anchor for our replacement bridge, which is New Teeth Now.
And one of your patients, Ron Wilson,
Yes.
is who we're going to hear from next. He had new teeth now 4 years ago, and he's going to tell us how his new teeth have really changed his life. I'm really excited to see this.
New Teeth Now has affected my life in ways I never expected. Before the procedure, there was the anxiety and almost fear at times as to how I'd be seen, how I came across to people. But since the procedure, it's been, well, I won't say miraculous, but pretty darn close. Yeah. Being able to have good oral health is an integral part of having good health in general, and I'm living proof of it. It's made me thinner, it's made me healthier, made me happier. It's about 65 pounds less of me than there was before. It's gotten me back to eating fruit and raw vegetables and all those various other things that I stayed away from before because it might cause pain or damage at that point. It's been 4 years now, and with my follow-up with Florida Dental Implants and oral surgeons, it's been a wonderful experience. My friends have seen the difference it's made in me, and it's positive. You never get a chance to have a second first impression. And being able to smile, greet friends, and make new acquaintances is an absolute plus.
So he's lost over 60 pounds
Wow.
in 4 years, just over 4 years. Wow!
He didn't really go on a diet. He just, because he could chew, he just automatically started eating healthier food.
And what a gift that is to your body.
Oh, yeah.
Let's talk more about this, how weight loss can be attributed to just having better teeth.
Well, if you have bad teeth or dentures, your diet is going to change because you're going to go to softer, carbohydrate,
Chips,
loaded food.
pudding,
Yes,
cookies,
absolutely. All those things
cake.
that make your waistline grow.
That makes sense.
So with a mouthful of teeth that are very functional, return you to 100% of your normal function. You have molars in the back. That's where you grind up the food, grind up the meat, and it's fabulous, fabulous. So he's a living testimonial to what happens, and it was done 5 years ago. So
That's incredible.
Yeah.
You can tell from the video of him eating at the table
yeah.
versus the interview shot of him. He looks like a different person.
And when I see him, we do a checkup with an x-ray, and I look in his mouth. It looks just like the day we put him in. The zirconium is very easy to clean. He does a good job with just a regular toothbrush, and the implants look brand new. just like when I put them in.
It's incredible how teeth and good teeth will change your eating habits. I mean, I know for anyone, if you're sticking with a diet of fruits and veggies, you feel better too. You feel younger. You have more energy.
Sure.
But if you're going
Sure.
for the things that are easier to chew and more snack and processed foods, you're going to feel more sluggish. And on top of that, if you're not happy with your teeth and your smile, I mean, that just compounds for kind of a really negative situation if you let it.
If you don't have teeth, you want to stay home.
There you go.
You don't want to go to the gym.
Sure.
You don't want to go out with your friends. Oh, I'll just have the soup. I'm not very hungry. You know, that's a
Right.
bad thing. And you know, that first impression is very important.
Debbie from Ruskin has a question, and thank you so much for calling in. Continue to do so. We're still taking calls. She says, my dentist said I need a single implant, but the dentist said that takes several months because she would need to get bone grafts. If I have a single implant and it takes a few months, how can you do a whole mouthful of teeth in one day? That's a great question. I'm glad we're going to be touching on this.
Yes, I think we need to.
Right.
So if you have good teeth, but you have a tooth that breaks and it has to be removed, and that's a whole different technology, and it does take some time to let the implant heal. And it's all because of the physics and, you know, new teeth now, all the implants are tied together. That's different from a single tooth. Now, we do a lot of single implants. We might put 2 or 3 implants to replace teeth if their other teeth are in good shape and they don't have periodontal disease. But for some reason they've lost 1 tooth or 2 teeth, then we aren't going to recommend new teeth now, the full mouth reconstruction for those people. They just need 1 or 2 implants. And we do have to wait from 3 to 6 months for the implant to heal before we actually put the tooth on. But we always have a replacement tooth, something that's going to be temporary.
And why the 3 to 6 months?
Well, in the upper jaw is a little softer bone. We know that the implant heals better if it doesn't have any force on it. Letting it stay in the bone and letting it heal and integrate with the bone is the best way to do that. If we put a tooth on right away, it would put too much force on the implant and it would fail.
Sort of like when a bone's healing, of course you want to wear a cast so that there's
cast.
no movement,
right?
So that it can heal.
Now, new teeth now works so well because of the physics and engineering. The implants are around the dental arch and they're all tied together, so forces are distributed around the arch, and that allows us to put the teeth in right away. And that's very effective. It actually helps the implants to integrate better.
Exactly, because integration is
That's the key.
the bottom line.
Right.
That's going
They have
to
to
keep,
fuse to the bone.
That's going to keep everything in place.
That's right.
And talk more about how the cells actually fuse with
the implant?
the implant.
Well, most people don't think about their bone as being alive, but it is. There's cells that are inside the bone. They're called osteocytes. So the osteocytes actually cling to the surface, that roughened surface of the titanium implant, and that makes the implant adhere to the surrounding bone on a microscopic level. So that's why these work so well.
Wow, this is fascinating. We're going to actually hear from Christina.
Okay.
She had severe dental pain, and that is such a huge fear for so many
boy.
people. What could be worse than
Yeah.
severe dental pain in your mouth all the time? And so we wanted to show you what she had to say about her
Okay.
experience at New Teeth Now.
I would go to the dentist every 3 months, and I dreaded it. It was horribly painful. So I went to Florida Dental Implants and seen Dr. Musser, and I explained to him what I was going through. And I woke up from that procedure and had absolutely no pain. I was pain-free, have been for 2 years. I eat, I drink, I do anything I need as a normal person to have in a meal with no pain, absolutely none. Florida Dental Implants, they will make you pain-free. And on a financial end, I think it's one of the best investments I've ever made. 100%.
I agree. I mean, I think investing in something as critical to your life as your smile, your self-confidence, and something that affects even your diet is invaluable. Absolutely. We're going to get a question now from Tanya in Dade City. And by the way,
Okay.
thank you for all your phone calls. Please keep calling in. We're still taking phone calls. Tanya has dentures.
Okay.
She hates them. They hurt, she says, and I'm always afraid they will fall out. My doctor says I don't have enough bone for implants. Can you help me, Dr. Musser?
Well, as
You
I
can.
said before, we can, yes. There's not a patient out there that we can't treat. No matter what the bone condition, we have implants that will work. So, you know, what all of our callers need to do is call our office for a consultation. Let's find out for sure what we can do for you.
And the consultation takes, you said, about 1 hour.
About an hour.
Pretty simple.
Uh-huh. We do a CAT scan, sit down.
Why a CAT scan instead of just an X-ray?
Well, the CAT scan is much more accurate than an X-ray. It shows much more detail, and it's accurate to within 1/100th of a millimeter. That's very accurate. We can make measurements and see anatomical structures that an ordinary dental X-ray wouldn't tell us about.
I think what is just so hard to almost believe is that it's almost pain-free. Because there's a lot happening with this procedure.
Sure.
I mean, you see what happens with this technology if you're having this procedure done. There's a lot to it, and seeing testimonies like Christina, who we just heard from, with her beautiful white smile, dazzling white smile, and she'd had such horrible experiences with the dentist before, and for her to say it really, there was no pain. She actually said that. And
Well,
that
that's
is
not me.
why.
I mean, that's the patients.
Exactly.
That
So
are telling you.
take us through exactly how you make it so that patients aren't in pain.
Okay.
Or are in very little pain, because that's probably what you may be watching thinking, really? Are you serious?
What we do is have the patient totally asleep, and we make the teeth that we're going to use on the day of the surgery ahead of time. So all the preparations have been made. You come in, you're very comfortable, off you go to sleep, and I do what I need to do, and put in the implants in the right place, and I use the teeth that are made ahead of time as a guide for where I'm going to place the implants. And before you wake up from general anesthesia, we use some numbing medicine inside the mouth that lasts all day. And then you spend a few hours in a comfortable recovery area. Your family can be with you, and we put the teeth in, and you can go home. So the reason nothing hurts is because nothing is moving in your mouth. If the implants are placed and they don't move, the teeth are attached to the implants, so there's no pressure on the gum tissue at all. And that actually, the teeth actually cover the incision line. You do have some stitches, but they're the kind of stitches that dissolve.
Okay.
So when people come back to see me in a week or 10 days, the stitches are all gone and the gum tissue is healed.
And when they go home that night, they don't stay overnight at all.
No,
Okay.
no, everybody's able to go home. And you can start with soft foods right away, and then progressing as you feel comfortable. But the teeth eventually feel like they're your own teeth.
We're much more adaptable than we let ourselves believe, right?
Well, we live in a great time.
We
now,
do.
Where we can get things fixed.
And I know your patients, some of them are just really frustrated when they come in. And we're going to hear from one right now. Her name's Anna. And she really kept going to her dentist over and over. More money, more money. And she was just fed up. So she came to New Teeth Now and met you. So we're going to take a look at her story.
Every time I went to the dentist, it was always about, well, we can't really work on your teeth. Your gums are bad. Your teeth are mobile. You need deep root cleanings every 6 months. Money, money, money. And that's when I turned around and looked at my husband and I said, you know, we got to make this happen.
That's great.
Fabulous.
Awesome.
Oh my God,
Have you had a long day?
I have.
Yeah?
Yeah.
Okay, a good day?
Yeah, great day.
Since New Teeth Now, I don't have to worry about what restaurant I stop at, what menu, what food. I mean, I just can eat anything I want. I eat steak, I eat chicken wings, which are my favorite, by the way. I eat apples, carrots. Well, I will tell you that between our romance with my husband, he just is constantly telling me how beautiful I look. Go to Florida Dental Implants and go and at least talk to them. I will tell you, I was skeptical. I'm like, wait a minute, how can it be that easy? You know, after years and years of pain and money put out, how can this be a final solution? And it was a final solution, and it changed my life.
When we're talking about the implants, how long do they last?
Well, the implants last forever. They're fused to the bone, so they're not going to go anywhere. And I've seen people that have had my implants in from 20 years ago.
No kidding.
They look just like the day I put them in because they're stimulating the bone. The bone structure has stayed the same, and the implants, because they're fused, look just the same.
The patients we've heard from, their teeth are so white and beautiful. Is there any extra care that's needed to keep them that white, or are they more prone to yellowing or staying white than regular teeth?
No, the finished teeth are made from zirconia. That color, whatever color we pick, is going to stay that way forever. Okay, they aren't going to stain. They aren't going to break. They're perfect. They're better than your enamel that's on your natural teeth. Okay, that's hard to believe, isn't it?
It really is.
Yeah.
I really love that people are calling in right now and just kind of asking whatever's on their mind related to New Teeth Now and dental implants, because the key is educating and taking the fear out of it. A lot of people are afraid to go to the dentist or have anyone touch their mouth. I understand that. I'm afraid to have my teeth cleaned, for heaven's sakes. And so I think it's just so important to address the pain management perspective and the fact that every patient we've heard from has said it really didn't even hurt, which is so hard to believe.
Yeah, you know, we have 50 people that work in our facility, and they all know our implant patients. You know, they're standing up straight, they're smiling.
I love that.
And everybody in our facility, right from the receptionist to the surgeons, anesthesia staff, they all understand. They know that this is a big deal. You're taking a big step and you're apprehensive. So we try to help that along. Part of it's our facility. We have a theater, it's very comfortable, and we do everything we can to make it easy for our patients.
I can tell you care a lot about your patients. And Joy Cannon is one of them. She had severe dental problems and chose New Teeth Now because she was able to come in the morning and leave the same day with a new set of teeth and a full set of teeth. And that's true for every patient who comes in. Take a look.
Yes.
I was very self-conscious about smiling and eating. Now and again, I would have a break off of my teeth or a bridge. So I started doing research on the internet, and I realized that there was only one place that I really was interested in coming, and that was to Florida Dental Implants. I was very excited. I felt like I had found what I was looking for. Well, I liked the fact that you could go in that morning and leave that afternoon with teeth. So that was a real selling point for me. When I came in the morning of surgery, they were so professional, put me at ease right away. I woke up from the surgery, and they were monitoring me, and then they brought my husband in, and that was something I really enjoyed, being able to have my husband there. I ate yogurt. I brought some yogurt. I ate yogurt right away, and then they took me into another room, much like a little dental office with a dental chair, and they put my new teeth in, and I was absolutely shocked when I saw them. It was an awe moment for me because it was exactly what I wanted.
It just sounds like New Teeth Now is giving patients like Joy a renewed sense of happiness, confidence, a new glow is what I see from her.
Yeah,
self-esteem.
Yeah.
And they last a lifetime, but they went in one day.
That's right.
And you can tell Joy is full of joy. She's just so happy that she made this kind of tough decision, but went with her gut And she's obviously so excited about the results.
Well, everybody at New Teeth Now is very excited about what we do, and we know we turn a lot of people's lives around. We make people happier and more self-confident. Gosh, how can you beat that? That's a great way to spend the day.
It sure is, and it's been a great way to spend this hour, Dr. Musser. Thank you so much.
I hope we touched a lot of people, gave some information, and by all means call for a consultation so that we can give you an accurate treatment plan and you can quit worrying about your dental condition.
And even if you just have questions, if you're not sure that you're at the step where you want to come in and even have a consultation, still call the number at the bottom of the screen. And any question, no questions too off the wall, right?
No, we have people that are very knowledgeable. Our implant coordinators have, at one point in their career, were oral surgery assistants in the operating room. So they know the ins and outs, they can answer all the questions, and you really should call just to get your questions answered, and you can do all that before you actually come in to talk to the doctor.
Exactly.
You'll know about fees and how long and all the logistics that are involved by having a conversation with one of our implant coordinators.
All right, well, one more time, the number is 855-544-5092. It's been an honor to spend this hour with you, Dr. Musser. Thank you so much.
Thank you, Janie.
Thank you. Have a great day.